Welcome to the HealthLaw HotSpot. HealthLaw HotSpot is a podcast for physicians and health professionals that covers the legal issues and trends that affect the healthcare industry.
Hey everyone, welcome to the HealthLaw Hotspot. I'm Ericka Adler, shareholder and leader of the healthcare practice at Adler. Today I'm with Lucy Zielinski. Lucy and I have worked together for many, many years, and for over 25 years, Lucy has been working with operational and strategic planning and other issues for both practices and health systems. She's with Lumina Health Partners. And so those of you who may not be familiar with Lucy, I know my clients are because we work with you quite often, but I have used Lucy for everything from helping physicians and others to start new practices, helping them figure out compensation and how to do value-based care within their practices, and even for coding and auditing type issues. So Lucy brings a wealth of knowledge to practices and health systems both. And thanks for coming today, Lucy.
Thank you for having me, Ericka.
So today we're going to talk about just one of the many things that you and I have worked on together, which is helping physicians to start a new independent practice. And this is something that, surprisingly at a time when we feel like all the practices are selling out, there are many, many providers out there that are starting new practices. And a lot of them will call and want me to help them. And I'm very happy to help them. But most of the work that goes into helping to set up a practice is not legal in nature. There's a lot of operational planning and work that goes in, and lawyers can certainly provide some assistance, but we are not the experts, and at least I'm not, in many of those operational items. So I thought what we could do today is kind of give everyone out there an idea of what the planning process is for starting a new practice and some of the things they should be thinking of, and perhaps even some places they could look for answers that they may not be aware are, available to them. So what would you say is one of the first things that you like to tell somebody who wants to start a new practice? What should they be doing?
Yeah, good question, Ericka. I would say, do you really want to start a practice? And understand the reasons why you really want your own independent practice. As you know, there's been a lot of changes in the healthcare industry over the past couple decades. We were starting up practices 20 years ago a lot. And then in the last decade, I would say that many physicians have been going more to employment, private equity models, or health systems. And now we're seeing some still want to start up their practices. So I think you want to start early, 6 to 12 months before you want to start your practice. And I think the first thing is a good plan.
I agree. And one of the first things I like to say is, where do you plan to work and why did you choose that area? What are some of the things that you think are important when choosing a location?
Yeah, I think the location, first of all, ask yourself the question, is that where I want to practice medicine? Because it is a big investment. And a huge career move to start an independent practice. So when you're thinking about location, you want to take a look at, obviously, the space and make sure you have enough rooms and access and workflows for the patients. I think more importantly is to take a look at the patient demographic in that community to really determine what their needs are, and then look at who's in your market. Who's your competition? Are there any retail providers? Are there any virtual groups in their market? And who will you be up against?
Right. And there's different kinds of practices, of course. Like we help a lot of new concierge practices start, and not every neighborhood can support that, right? And then you have some neighborhoods where they've got a payor mix that may be more or less advantageous depending on your specialty, right? So we definitely want people to look at that. One of the things I want to mention is that there are some great companies, and I've had them on my podcast before, that really help physicians, once they've kind of narrowed down to an area that they may be interested in, to see some of the spaces that are available. And they really help you kind of pinpoint, things like, is this a good corner for visibility? Is this a building where there's other specialties, but not your specialty, which actually can be a nice fit. And then those types of consultants can help you build out your practice and kind of work with you on the design and all that kind. But, that's something that really wasn't so much the popular approach, 15 years ago. We're dating ourselves here, but and that is, I really see them as partners with physicians that are looking to start their new practice. So they do a lot of that market research, which I know you and I have talked about as being really an important part, because if you put all that time and money into starting a practice and there's too much competition, or it's not the kind of service that's needed in the neighborhood, then you've just, wasted a lot of money and you could potentially fail.
Absolutely, absolutely. That is so key, making sure you find the right space in the right location. And to your point, there are many not only real estate agent, but design firms who can definitely assist you with this.
All right, perfect. So once you choose your location, I like to recommend that you go ahead and form your entity at that point. Okay. So if you're doing it yourself, great. You talk to your accountant and your lawyer, you form your entity. If you're doing it with a partner, then you still need to do that, but there's a little bit more work involved because you'll have an agreement between the two or three of you, however many there are, about what that relationship's going to look like. And the reason I say to form the entity now is for what we're going to talk about next is the credentialing, the
Yes.
perhaps borrowing money from a bank and starting to contract and get your business up and running. And you need a legal entity really to do that. So let's talk about the first part of that. You form your entity, and then let's talk about credentialing. Okay, so what is your recommendation in terms of the amount of time needed for credentialing, and the best way to approach that?
Yeah, credentialing. So credentialing is obviously working with the payers to make sure that you can be paid for the services that you render. And the whole credentialing process, or sometimes we call it provider enrollment, I recommend a 6-month time period on ramp. And so that just gives you a little bit of an indicator of how soon you have to start, because sometimes it does take quite a bit of time to have you enrolled with some of these payers and be compensated for your services. And then you have to do all the updates, right? All your address updates, all your tax ID updates with CAQH or whatever tools that you're using out there to support your credentialing process. So you definitely want a good timeline there to make sure that once you open the doors, you can bill and get paid for your services.
Right. And I know that with credentialing, obviously, we start thinking about which payers you want to be with and who's going to do your billing. So I know you had some thoughts about that as well, that providers may not realize are out there. Can you speak to that?
Sure, sure. So take a look at your payer mix in the area. I mean, many Medicare Advantage is growing. I mean, we've seen a huge surge in growth, and that's only even growing even more. So you may see more Medicare Advantage, Medicare population in the area that you're in. And so you definitely want to start. We always recommend start with the government payers, start credentialing there. Usually that timeline is a little bit longer. And then survey the partners, your hospital health system partners in that area. There may be a clinically integrated network. There may be an accountable care organization or a hospital partner or a large group that you may want to join forces and be in their networks. So that's very critical to determine if you're going to go direct to the payers and credential or through another entity, which if it's a smaller practice, we always recommend take a look at who else is there to try to credential that way. And once you're credentialed, obviously billing and collections is critical. First, you need the right system, right EMR, and I always recommend that whatever electronic health record you're using, you want to make sure that your practice management system is integrated with that. And today there's many systems out there. Even hospitals are offering systems to independent practices as well for kind of a reduced cost. And then you can share a lot of the data, which makes absolute sense. And typically with billing and collections, there are many vendors out there. I usually recommend that you explore your options in finding a third-party vendor because of backup. If you have one person doing part-time billing work, gosh, forbid if that person wanted extended vacation or they were out of pocket and couldn't do your billing. So you definitely want a good, solid plan. And I recommend going with a third-party vendor that's reputable.
Okay, great. So you mentioned the EMR and the billing, and obviously these are two of the most important contracts that you need to get signed. But some of the other things you'll need to start thinking about as you start your practice would be maybe computer systems, equipment that you might need in your office, vendors that you're going to do business with, credit card machines, whatever it is. So you really have to kind of plan ahead. And I know that's one of the things we try and help our practices come up with a list of contracts that they're going to need and to start working on. There's just so much that planning ahead, make sure that you have enough time. So once those are in place, and again, this is the reason you need your entity so that you can enter into those contracts, we start kind of getting a little bit closer to really getting up and operational. And what I like to think about at that point are insurance and benefits. And you and I were talking earlier that a practice needs to think, and by the way, if it's just you have no receptionist, you have nobody working for you, obviously things are easier. But you do want to think ahead. You may have a receptionist, you may have, an MA or a nurse practitioner. And so these are the kinds of things that you will need at that point, which everything from payroll, health benefits, retirement plans, insurance, etc. And there are for small practices, we're seeing some really nice PEOs. And again, if you look back through our podcast, you'll see we've interviewed a couple of those. And basically what they're doing is they're going out to practices and saying, hey, let us be your HR solution. We offer these services or we're competitive and we'll get you better pricing than you currently have. And we will oversee the payroll, the benefits, etc. So you don't have to shop around and have all these different people that you're in business with. And they're really directed to the healthcare practices. So that's, they have the practice in mind and they're built for practices. And I love this because we're seeing new solutions coming out for independent practices. And I'm really hoping, this will help take some of that administrative, hassle away that's making it so hard for practices to stay independent. I don't know if you've seen any of those types of businesses out there.
Oh, I have. There's several of them, and I would highly recommend them. Typically, the staff that you hire, they're not experts in human resources. And so you definitely want a partner that knows compliance. I mean, this is huge. That maybe even can do background checks for you, can do some group benefit packages, maybe even a 401k. Because they do gather more people and they have access to better rates usually than if you didn't do it alone.
Right. And I love that you mentioned background checks because this is so important in healthcare. I have quite a few situations going on right now where people are hired and their references weren't checked. And there was no official background check done. And we've ended up in a very tough situation. But in addition to just kind of disputes, and let's say dishonesty within the practice setting, there is a mandate to actually check the employees that you're hiring to make sure they don't show up on the OIG exclusion list. And this is something that you do when you hire someone and then regularly thereafter. If you do hire someone who appears on that list or they end up on the list and you never find out about it, you can actually lose your Medicare provider number. And so people are always shocked kind of when I tell them they've never heard of it. And even more so, let's say you build a fabulous practice and you go to sell. One of the key points they'll ask you is, how often did you check that list? What list, right? So it's a really important thing. And the background check is great. If you can hire a company that can do all these different things for you, you can certainly do some of this yourself, but it just makes it that much easier. And then on an ongoing basis, your employee manual, the policies on sick leave in Illinois, for example, they change all the time. You could have your county might have different policies for sick leave. You can't possibly keep up with it all on your own, right? So this is kind of a resource for independent practices, and I think it's really helpful.
Yeah, and they're compliant, right? They help you be compliant from a human resource perspective. And many of them will even help with recruitment and some retention efforts as well. So it's a great resource.
Right. And so let's talk about recruitment when it comes to employees, right? There's a lot of resources out there. And I know you play a role in helping practices figure out, and not just for your receptionists, but for your actual doctors and your nurse practitioners, you help them kind of figure out the compensation piece of that. So, what do you recommend for somebody that wants to hire, not sure, how to make it attractive?
Yeah, that's a good question you bring up. That's a great question. I would have to first answer that by saying you really want a good fit. This is a small staff. If you're a single doc or maybe somebody with an APP as well, you want to make sure you're hiring the right people. I always say hire slow, fire fast. Make sure your values are aligned with that individual after they passed all the background checks, right? Make sure the values are aligned, and what they're looking for is exactly what you can give them as far as work-life balance, hours, and that sort of thing, because it is so hard to replace somebody, especially in a small practice. So you want to make sure at the onset that you're hiring the right person.
Right. And often not everybody needs a written contract. A job offer can be fine. For more formal physician contracts, you'll want to talk with somebody like Lucy to figure out how to structure compensation, bonuses, maybe a value-based type bonus. And for mid-levels, and I know, Lucy, you feel quite strongly that these are really important to be a competitive practice. So your PAs, your MPs, they, depending on if your MP is independent or not, you're going to need supervision type agreements that are on file. And so those are legal forms. That's when the lawyer can actually do something to help.
Yes, and you want to make sure they're market rates, right? And your office to be competitive with that. But there's many questions you can ask a lot of these mid-level providers. Some of them don't want to work full-time, or they want certain hours, or they're actually willing to do telemedicine. Imagine that, somebody who can do some of your telemedicine or can review your messaging, do refills, and all sorts of things remotely. And so you could leverage some of these providers in a unique way, including even care management services, and still be bill and be reimbursed for these services. So being a little bit creative and working with that individual to make sure it's a win-win is definitely important.
Right. And then one thing I'll mention, which is actually a separate topic that you and I have covered before, is to never, when you're starting a practice, I know doctors are busy seeing patients and they tend to hire someone they think is great and they become really reliant on that person. And Lucy and I have seen some disastrous situations where you have a fabulous person working for you. They have all the passwords for everything. They have access to the bank accounts, and the doctor does not have that information. Something happens.
Your private Gmail account, Ericka.
Yes, their private Gmail account. They may do something dishonest, even if they seem like the greatest, hardest working person in the world. You need access to all that. Everything should be coming to you. You should be copied on everything. There is nobody other than the doctor that should have control of any of that information. And don't forget that has to be the number one piece of advice when you're starting a practice: is don't rely on anybody but yourself when it comes to your security of your practice.
I would underline that one, Ericka. Underline that one, because that is so critical. Many physician offices, if somebody leaves, they're held hostage because they don't have access to passwords to key information. My recommendation is typically to work with an outside IT company, even if they don't provide you a lot of IT services. But if they could make sure that you're compliant, everything is protected. I mean, cybersecurity, this is a real thing these days. And so make sure that you hire somebody and let them be the keepers of the keys. Let them hold your administrative passwords and all of your passwords. So in the event somebody leaves, you can just make one phone call and they can really just update systems and change passwords fairly quickly. Because I'll tell you, I don't know that many physicians can move on a dime like that and make changes to their IT systems.
Right. Yeah, it is really heartbreaking. Over the past 25 years, I can't even tell you the number of situations. It sounds like we're making up crazy stories, but yeah, if everybody out there only knew the kind of things that we hear about every day. And so that's a really great thing to be aware of. So that kind of brings up the topic of two different things. One is compliance and the other is insurance. And you kind of talked about it, cyber security. And really, one of the key things before you start your practice is to talk to somebody who sells insurance, in addition to general liability that's going to cover like your space and everything, and your malpractice. Of course, you need to make sure that you have coverage for cyber liability as well as HIPAA violations as well. Sometimes those are built in. But you want to make sure those are in there. There's always new types of packages. You can also get some kind of coverage that covers employment claims as well. So you really want to talk with someone. Just don't buy something off the shelf. Talk with somebody who knows the different kinds of insurance that a healthcare practice needs. You'll be happy to have it in the long run. It'll save you money in the long run, especially these days with HIPAA claims and cyber claims. So.
And I think, Ericka, one of the things that physicians definitely can do is check with your local or regional, even state, national medical associations. Many of the associations can definitely put you in contact with insurance brokers that specialize in physician practices.
Yeah, that's a great idea. Actually, you should check with those societies for a variety of different things that we've covered here. One of the other things is, the forms, the intake forms that you're going to need for patients. So we will often help prepare those. We'll perform the form of BAA, business associate agreement that you need, the financial forms, et cetera. But a lot of these medical societies and even specialty specific societies do have some of these forms available for their members as well. Also, interestingly, a lot of EMRs have built in some of these forms. So before you go out and necessarily need to hire a lawyer to do this for you, there is some kind of legwork that you can do to see if that stuff is already available to you. So, okay, so a topic near and dear to our hearts is compliance. And I know you're not even up and operating yet. Do you really need to worry about it? Yes, right?
Yes.
What do you ending these days? I know I send you doctors that have been audited, and what kind of preventative advice are you giving?
Yeah, I think compliance, more on the coding and billing compliance, I'll start there, is to make sure that you're doing regular audits to ensure that you and your staff are billing and coding appropriately within guidelines. Guidelines change every year. Physician fee schedule updates change every year. So ensuring that you are coding and billing appropriately is so important. And Ericka, you and I see many physicians being audited by CMS, and we have to respond to those audits, and they're very time consuming and cumbersome to respond to. So anything that you could do on the front end to avoid any audits, that's definitely something I would recommend.
Right. Compliance plan is a good idea. And just remember also, if you're going to do an audit, even though I personally don't do the audits, all your audits should always run through counsel so that they are attorney-client protected. So if you're hiring someone like Lucy, it goes through counsel to make sure that if she finds you've absolutely screwed something up, that'll be, among friends, right, while we fix it. So it's something to really think about. And, a lot of these automatic refunds, or there's like just small little audits, they go on very regularly. Those aren't necessarily things you have to call your lawyer about. It's more kind of the larger, more significant inquiries that are being made, where you really may not want to handle it on your own before at least checking in with counsel. So especially for new practices, they may not be using certified coders and billers. They may feel they don't have the money to run an audit early on. These are just expensive mistakes sometimes. So you got to be careful, right?
Yes.
Okay. So let's talk about social media. Mm-hmm. I know you were talking to me about how much of an impact it's had on practices, and I'd love to hear your thoughts on, starting up a practice and the role of social media.
Mm. And if you think about the generations today and where we've evolved over the past 20 years, I mean, we are Googling and inquiring and reading reviews about that physician. I mean, that's the first thing many of us do is, oh, we have a referral from a friend. Let's go ahead and check what the internet says about that physician. So regularly reviewing social media is definitely important because your reputation's sitting right there. You may or may not even know what other folks are saying about you. So look at that. And then I think having a solid marketing plan that revolves around your website and social media, whether you're using Facebook, whatever that online presence is, it's definitely important because that represents your brand. So have a solid plan for a website with your services and updates and maybe even a newsletter, and then some outreach with using social media.
Yeah, social media has just become, really important. We work with a lot of practices when they are perhaps receiving false reviews that hurt them, sometimes negative reviews, although there's sometimes very limited options to address that. But social media has become really important. I love that you use the word brand because that's so important. One of the things that I should mention is that when you're choosing a name for your practice, you should talk to someone, not just to see if the Secretary of State in your state has the name available, but you should see what very similar names might be out there, if not the same name that could be used in other states or just even on the web, because or even Facebook or Instagram or whatever. If you start using a name that somebody else is already using and has developed a brand with, they can interfere with your ability to use that, whether or not they have a trademark, whether or not they have a state presence. So you really do want to come up with a unique name if it's something that you're really thinking to put time and money into branding. If it's more like a generic, like Midwest this or North Shore that, you aren't likely to really be able to protect yourself. But I'd hate to see people spending time and money on branding without making sure that they've done their research, come up with something unique, trademark it, and protect yourself. So those are my thoughts.
Yeah, very important. And the one thing, Ericka, I think we didn't mention early on, and I just want to make a point here. One of the most important things is to put together a financial plan. A financial plan outlining your startup costs, your expenses moving forward, and really how you're going to pay the bills from month to month to month, because it's going to take maybe 6 months to a year, maybe 18 months to build a full practice. And so during that time, how are you going to manage your money? So making sure that you have a very sound budget, pro forma, on what year one looks like, what year two and year three looks like is so critical, because the last thing you want to do is have this great idea to open up a practice, but then you don't have enough money to run it. Because truth be told, this is a medical practice, but it is a business. So you definitely want to treat it with some good financial planning.
That's a great point. And actually, that probably comes before any of the other steps that we've talked about. There are some really great professional lenders out there that work with physician practices. They understand what's involved. They understand the startup costs. They understand the time frame. And they're great partners for so many practices, and always happy to make those introductions to our clients that are out there. But I do recommend that practices kind of talk to professional bankers as opposed to just your banker down the street at the local bank. It's a very different perspective, and you really understanding the financials and what's involved can be very different. So just like if you're doing a restaurant, you want to go to somebody who knows about restaurants, right? So
and accountants are very critical. So make sure that you go to an accounting firm that knows physician practices, medical groups, that's very familiar with how funds, accounts receivable, how money moves around, because it is quite different than kind of a retail business.
absolutely. And again, we work with some great professional accountants, and you're absolutely right. They talk the talk. They understand the billing, the coding, the auditing. They understand the cost of running a professional practice, whether it's medical, dental, or otherwise. So there's really, I feel like all the people who are in this space, we're really connected. We want to help practices start up successfully and see them really thrive. And I think you can see between the hospitals, as you mentioned, and the medical societies and the people who specialize in this area, there's a whole team of people that can help you start and a practice and really thrive. So I hope everyone listening has gotten some ideas about what's involved with starting a practice. You should feel free to reach out to Lucy. I'll have all of her contact information and me, and I'm happy to give you the names of any of the type of specialists that I talked about today. And hopefully, with a little bit of hard work, you can have your very own independent practice. And I think it's getting easier than ever to start a practice and to stay in business as a practice. And that's a really positive change, I think.
Yes, I would agree. I would agree. And many physicians, I think the one thing I wanted to mention is make sure that this is something that you want to do. It's a big undertaking to start a medical practice. It's a huge commitment, and a lot of work goes into it. So make sure that before you even have this idea, that you explore this idea very well and understand what it takes to operate a very successful business as a medical practice.
And still practice full time.
In practice, yes. Yes, right. Because you're not only a physician, but you're a business owner now.
Right. All right. Well, thanks as always, Lucy, for joining me. I hope this has been helpful. And I guess we'll see you next time on the HealthLaw Hotspot. And you can see our other episodes at ralaw.com. Thanks for joining us.
The Retzel HealthLaw Hotspot is made available by the firm and its attorneys for educational purposes and to provide general information, not to provide specific legal advice. Use of the Retzel HealthLaw Hotspot does not create an attorney-client relationship between you and the firm or any of its attorneys. The Retzel HealthLaw Hotspot should not be used as a substitute for competent legal advice, and you should contact an attorney in your state about any legal needs or questions you may have.